doctors, Dr. Albert, our Principal Medical and Health Officer of CHP, and Dr. Larry Lee, Chief Manager of Hospital Authority. Dr. Au will give you an update. Good afternoon, Hong Kong citizens, friends from the media. Let me report on the COVID-19 situation as of yesterday. We recorded altogether 1,014 local cases, including 379 PCR positive cases and 635 positive RAT results successfully declared on the platform and confirmed via PCR. And yesterday, altogether, we recorded 131 imported cases. Cumulatively, since the fifth wave, we have recorded 1.211501 cases. Of the 131 imported cases, 67 of them were picked up at the TSCC at the airport. 54 were picked up in either hospitals or quarantine facilities. As for 10 other cases, they tested positive after 7 days of quarantine. We recorded one death case as of yesterday. Cumulatively, the death count since the start of the fifth wave in Hong Kong is 9,180. For residential care homes yesterday, 4 homes reported new cases involving staff members in these homes, including 3 RCHEs and 1 RCHD. And they include Sun Shan Wu Lo Ji Ga and Shang Shui. 1 care worker was involved, and 17 residents and 1 staff member are close contacts. The other is in Fanling, Bozhong Chunying, residential care home of Tonghua Group of Hospitals. 1 staff member is infected, with 15 residents classified as close contacts. The other is Feng Dek Onlo Yun of Lutheran Church in Wong Tai Sin, involving 1 social worker, and 5 residents and 2 staff members are close contacts. The other is residential care home for the disabled, Fu Hong Society, Lok Wah workshop, with 1 staff member being infected and 16 residents are listed as close contacts. All the close contacts have been sent to the Asia World Expo for quarantine. An update on the residential care homes with outbreaks as reported earlier. In Kwun Tong, the Christian Family Service Center, Cheung Chun House, we have recorded 2 more cases, and these are residents already sent to the Asia World Expo for quarantine. In this outbreak, 14 residents and 1 staff member have so far been infected. As for schools, as of this morning, we have received 145 reports from schools involving 102 students and 43 teachers. 126 schools are involved, and of these schools, over the past 7 days, 51 of these schools recorded 2 or more cases in the past 7 days. And for 4 schools, we have identified some cluster outbreaks, including Zhonghua Geiduk Gaowei Guihua Shan Zhongho in North District. And for class 5E altogether, there are 4 cases. The other is Lei Xiu Geisiyuan in Yuen Long. For Form 1 English class, altogether 2 students and 1 teacher have been infected. The third school, Fanling Government Secondary School, Class 1B, there are 15 students and 2 have been infected. The last one, Guangzhou Gaifang Fului Hui Sunfeng Zhong Xiuhao in Tai Po, in Class 6D, 2 students and 1 teacher have been infected. We have advised the classes with which outbreaks have occurred to suspend face-to-face teaching for 7 days. As for kindergarten in Charming Garden, with early outbreaks in 2 green class, there are 2 students among 23 students being infected, and there are also 2 teachers having taught this class, and we have advised the class to suspend for 7 days as well. As for gene sequencing analysis, according to the Public Health Laboratory Service, we have identified 19 cases suspected to have a BA.2.12.1, including family members being close contacts. We also record one being imported case and 18 others as local cases. There are 5 untraceable cases and 4 others that are linked to the untraceable cases. They are family members. They lived in Block 4, one household with 2 cases in Lam Fung Shan Chun, and also in Lai Chi Kok, Wang Ging Tai, 3 cases, and Ocean Shores in Chang Kwan O, 1 household, 2 cases. Fonglin, Yezhou in Tunmun, and Dai Chung Hao in Saigon. There are also 9 other cases with epidemiological linkage with the previously reported cases. The other is the family member of the field and track team student in Puisheng Middle School. For 2 other cases, that's one of the close contact of one of the cases living in Oscar by the Sea, Oscar Club Cheng Kwan O. As for 2 other family members in the household, they have been infected as well. As for the last one, it relates to a previous case in Nam Wan Tunnel. It's a close contact. As for the last 3 cases, they involve the construction site in Fat Kong Street, Ho Man Tin, including 2 working at the excavator of the tunnel and 1 other worker. There are 4 cases have been recorded for this construction site belonging to the same cluster, and working the same team. And this new case works in another case. Altogether, 7 cases have been recorded. They all have been jabbed. For 6 cases, they have. For 1 case is asymptomatic. For 6 other cases, the onset dates were between the 6th and 14th of June, or the 10th or 14th of June, and they would use the containers underground for the purpose of resting lounge, and about 100 staff have been listed as close contact. We have issued the compulsory testing notice. They'll be required to take the PCR test, and we'll also conduct a site visit to see whether improvements can be made. On BA.4, BA.5, 5 more cases have been recorded. All were imported cases. On gene sequencing, for Rexity and FLM clusters, we have completed whole genome sequencing, and we have found similar substrain with clusters happening in earlier in different pubs such as Iron Ferry and Shuffle. Dr. Lee will give you an update of hospital authority situation. Altogether, 412 patients are in our system with 50 new cases. For those in isolation facilities, 103 are in isolation wards, 11 in second-tier wards, and 76 are in North Lantau Hospital, Hong Kong Infectious Control Center. Altogether, we have recorded 34 new cases. Yesterday, we did not record any death cases, and there are 2 new patients in serious condition, one having received 1 jab and the other having no vaccination record. There are 15 critical patients and 10 patients in serious cases in our system at the moment, and 3 are receiving intensive care. We also reported a 58-year-old female passing away yesterday. She is not an RCC resident. She did not have vaccination record. She had nasopharyngeal cancer. On the 21st of May, she was admitted to Princess Margaret Hospital, and the diagnosis at the time was that she had difficulty eating for 2 weeks, and the X-ray of her lungs showed opaque glass capacity, and the CT value was above 30. And since admission, her blood pressure had been on the low side with low blood oxygen level and low hemoglobin count as well. We believe this had to do with her terminal cancer condition. So on the 27th of May, she was transported to Grantham Hospital for further treatment. Her condition continued to deteriorate, and she passed away on the morning of the 10th of June.
In the last 24 hours, 55 patients recovered, and we have 51,127 recovered patients. 50,724 were discharged from hospital. We have 63,000 patients recovering, and 63,100 have been discharged from hospital, and we don't have any positive cases discovered in hospitals. 23,900 plus staff from HA were infected, and we also have 20,000 plus who have returned to duty. Now, in recent days, our infected cases are in excess of 1,000 per day, but public hospital is still stable. We have people admitted to hospital, but the number of cases that are serious and critical condition or in ICU are still stable. Most of the cases are stable, but we are not complacent. We still keep a close eye on the number of beds that are available. So even though we do have designated beds dedicated for COVID patients, but we have released them for general patients. But we do set aside a certain number of beds for quarantine where we can accept COVID patients. Now, if there is a significant rebound, each cluster can deploy beds, and in a short period of time, we can accept COVID patients. At the community rehabilitation side, AWE is in standby mode. If necessary, we can activate it, and these centers can accept patients in a few days' time. So we have set aside some human resources. We have a command center in place, and we can handle patients. We can reactivate the rehabilitation centers. We can also enhance the capacity of North Langtao Hospital. Lastly, I'd like to urge members of the public, if they are unwell, they need to get tested. If they are confirmed positive, they need to notify the government. They also need to get admitted to a hospital. The HA has 7 dedicated hospitals for COVID patients scattered across the territory. We also have oral medication. We want to urge the public to seek medical assistance as soon as possible, because that can help prevent serious complications. Q&A. Please identify your media outlet. Now TV, I'd like to ask Professor Hong Fan-Ngai said this morning that he would only report serious cases and fatalities. So I'd like to ask Department of Health, how do you view this arrangement? Will you accept that? And also want to ask, there has been an upward tick, but we don't have significant increase in serious cases. So how does the department view this development? Should we anticipate a further rebound? Thank you for the question. First of all, on the matter of trend, in the last 2 weeks, we've seen the number of positive cases go up steadily. We can summarize that the community has a lot of transmission vectors, and we see the number of cases going up. So the different indicators will illustrate that. We can see from a number of infections, the sewage virus levels, the Hong Kong U reproduction rate. We can see that the compared to the level in May, it is higher now. So when social distancing rules are relaxed, the number of cases will fluctuate at this level. Well, we don't want to see further outbreak, and fortunately, we don't see that yet. So I hope in the coming few weeks, the public should stay vigilant. If they have symptoms, they should get medical treatment. Regarding serious cases and fatalities, that's an important indicator. We need to keep an eye on hospital admissions, the number of quarantine cases, serious cases, ICU cases, and fatalities, because these figures will reflect how COVID is affecting Hong Kong and what impact it has on the medical system. So far, we're stable. And I think the main reason is that the community, the majority of the public, have immunity. That is, a lot of people have been vaccinated. Some people were infected in the fifth wave. So when they were infected and if they had been vaccinated, even though they might not be fully immune to the virus, we see that they come down with mild symptoms. So we're not too worried that it will add burden to the medical system, but we have to be careful where we don't let these cases infect high-risk groups such as schools, old age homes, and so on. So we hope students and teachers conduct RAT every day. Residential care home residents, they need to be tested every day and quarantined if necessary. Now, regarding positive cases being that need to be reported, well, we are monitoring the figures, hospital admission figures, serious cases. All these are important indicators. We'll have to keep an eye on daily figures to determine what percentage are serious cases or fatalities. TVB, Fu and Garden, Canine Kindergarten. We see suspension of some classes. Now, is there an environmental uh, outbreak there? Should school be suspended? Now, you say that the outbreak is within expectations, but there isn't a high risk. So if we don't tighten social distancing, but with upcoming Father's Day or uh, 1st of July handover celebrations, there are festivities. So how do you evaluate the coming 2 weeks? Will there be a significant uptick? Will CHP have to anticipate the festivities and celebrations ahead of us, that people should have less, should engage less in these activities? Now, I also want to know that the police, there is a suspicion that the anti-terrorist unit has an outbreak. How many people are involved? What follow-up do you have? Will there be mandatory testing in their workplace? Thank you for the 3 questions. The first is about Canaan Kindergarten. That's a large kindergarten. They have 413 students, 32 staff. In the last week, this school had recorded 18 cases and affecting 5 staff and 13 students. Now, if we look at the class distribution, they are concentrated in a few classes. So we suggested that these classes be suspended. But we don't have a lot of cases in each classroom. We're talking up till now, we only have 4 cases, and 2 other classes that are affected, that have to be suspended, only have 3 cases. So it's roughly 10%. And this is a consideration. This is out of safety concerns when we would recommend suspension of class. But we don't see any new cases arising. They do have a lot of classes, and when we look at the distribution, there is some social activities. They congregate at the ground floor. They might share washrooms. They would share a large common room, but they won't. But they use these facilities in turns. They don't use it together at the same time. We do suggest that they disinfect the facilities, so we'll keep an eye on them. The affected classes have already been suspended. Other classes, we don't see an outbreak. Second, regarding the trends in the community, there is an increased risk of transmission. We anticipate when social distancing is relaxed, the number of cases will remain at this level, will fluctuate at this level. And we hope that in the coming weeks, the public need to stay vigilant. That is, they need to wear masks. When they're indoors or when there are a lot of people, they could wear KN95 masks, and high risk groups, students should conduct RIT tests every day. And if they have symptoms, they need to be tested. But they also need to avoid large events or interfamily gatherings. With the upcoming Father's Day, there might be gatherings, but they should avoid interfamily gathering.
問題
Third point about one of the police departments having a cluster. We're aware of the situation and we have got an understanding and we're following up on the matter. In one of the police departments, about 20 colleagues have tested positive, and we have arranged for them to be isolated, and their family members will be subject to quarantine as well. We've also advised all relevant colleagues to undergo PCR tests, and for close contacts of these cases, they should avoid going to work for the time being. So we'll follow up on the situation in relation to what relevant premises and workplaces they have been disinfected. Next question. I'm from Orange News. Good afternoon. About Guaiwasan Secondary School. In a single class, we see 4 more cases. Do these 4 students sit close to each other in a classroom? Is there airborne transmission in the classroom, or is it because of sharing of use of facilities? Have all these students been wearing masks at all times? Have they taken off their mask for some activities for Lei Xiu School? The English teacher, did the English teacher teach other classes? And also there are 10 cases picked up after 7 days of quarantine. What are the CT values? Do you think that they are positive cases? There are 3 more workers in the Central Kowloon Road construction site being infected. What is the CHP's assessment of the risk of this site? Is it necessary to suspend works altogether? First, about Guaiwasan Secondary School. In one of the classes, there are 24 students and 4 cases have emerged. So these 4 cases share the same classroom with others, and of course they kept their mask on at all times except for drinking water. But of course there have been interactions with other students in the same class. In light of having 4 cases in the same class, we believe that the students might have been infected as a result of some sort of contact. So we have advised students of the class not to go to school for the time being. For the English class of Lei Xiu College, this is a Form 1 class. It's an English class, and there are 17 students coming from different classes. There are 2 students as well as the English teacher of this English class being infected. So in other words, we have 2 out of 17 students as well as 1 teacher. It's not a major outbreak, but we're concerned that there could be transmission taking place because these are connected cases. This teacher also teaches other classes. We checked the other 2 classes. At the moment, we haven't identified any other case. And for students in the original classes, there aren't other cases as well. So we believe that for the time being in this cluster, the students should refrain from going to school for the time being. As for the cases picked up after 7 days of quarantine, some carry a CT value above 30 or even higher, so they could be positive cases. For some cases, For example, in May, some were recently tested positive, and when they recovered, when they came back to Hong Kong, for some cases having CT values below 30, they also had activities in the community. So we would also conduct gene sequencing to see if they were infected after leaving the quarantine hotel. As for the construction site in Corentin, we have investigated the 4 cases. The 4 cases shared the same container. They belong to the same team. For the remaining team members, they've been sent to quarantine. We haven't identified other cases. For the 3 cases identified today, they worked underground. They were responsible for excavation. They operated, for example, the excavator and the drilling machines, so on and so forth. About 100 workers were involved. They had the morning and afternoon shift, and the 3 new cases identified today belong to the morning shift. But these 3 cases did not use the same container with the 4 cases previously identified. We understand that underground there are about 15 containers, and we're concerned that probably in an enclosed area with poor ventilation there could be further transmission. And we have advised the personnel working underground, that is the 100 workers, to suspend work for the time being and get tested by PCR to see if we can identify more cases. And meanwhile, the workplace will be disinfected, and we'll also consider whether there are other prevention measures that can be implemented. Next question from O1. Father's Day is approaching. So what is the CHP's assessment? Will there be a substantial rebound? For bars and pubs, RAT test results are required before one can enter the premises. Now, will the measure be extended to restaurants? In light of the recent rebound, what is the CHP's assessment? Is it appropriate to hold celebration activities to celebrate reunification of and also, we have more clusters emerging, carrying the different subvariants. I want to know whether the recovered persons have sufficient immunity against these subvariants. As for the coming Father's Day, I would say that the infection risk would definitely go up, and we need to observe and see whether there will be more cases after Father's Day. We reckoned that there will be more gatherings and meals with family members, and members of the public should be vigilant in observing social distancing measures. We believe definitely there would be inter-family gatherings. But do bear in mind when you have dinner together that you should keep your mask on at all times unless you are eating. As for RAT test requirement, according to the investigation we have conducted over the past few weeks and analysis of cases, apparently bars and pubs are high-risk places with a major risk of outbreaks because patrons tend to take off their masks, and that there are more interactions among patrons and more mask-off activities such as dancing. And we also noticed that patrons would tend to move about in the pubs, and they may also take off the mask and chat with others. So as a risk management measure, we want to prevent positive cases from entering bars and pubs. Under Cap 599F, for restaurants, there are requirements as for fresh air, and exhaust exchange, ventilation, etc. Restaurants don't have as high risk as bars and pubs, but we do keep in view the situation. If there are new outbreaks, we may consider other measures. As for recovered persons, whether they will be infected again. If recovered persons haven't been jabbed before, once infected, in the next 2 or 3 months, they may have immunity against the same variant. But over time, the level of immunity may drop and they may get infected again, as studies have shown. So they may get infected by new subvariants or even the same kind of variant of the virus. In fact, we have identified a case belonging to a bar cluster of this nature. So in order to boost your immunity level, you should get jabbed. According to Dr. David Hoy's study and Hong Kong U study, for recovered persons, after they have recovered, they can receive another jab so as to boost the immunity level and to, overall speaking, be immune against different variants.
Worrying trend of the increasing of the confirmed case number. So can you tell us the current situation of, the situation of the current wave? Because, and also Carrie Lam said she had a cross-bureau meeting with the hospital authority today. So what do you guys discuss? Is it, and how do you assess the current wave? And second, so one of the kindergarten recorded a increase in case number. Will the authority ask the kindergarten or school to suspend all the face-to-face classes? And also, so Carrie Lam also said that the government will require people to do more rapid antigen tests before mask-off activity. And also require it for the staff from care home. So how do you see the new measures? Thank you.
Thank you for your question. For the latest epidemic trend, we have observed a gradual increase in the disease activity in the past 2 weeks, as reflected by the daily number of cases confirmed by RAT and PCR, as well as other parameters, including the real-time reproductive number by the Hong Kong U, and also the percentage positive among the sewage surveillance results, the viral load per capita or per person. So there is obvious increases in the disease transmission in the local community in the past 2 weeks. This is expected as we have relaxed some of the social distancing measures, so there will be more social gatherings and also social activities in the community, especially some with high risk, such as mask off, including attending restaurants and also bars. So this is expected. We need to observe whether this will have a major impact on our healthcare system and also the medical burden posed to Hong Kong. And currently, as mentioned by Dr. Lee, there is no obvious increases in the hospitalization rate, cases requiring admission to ICU, and also the death rate. So our conclusion is that although the number of cases increases, but the impact still remain at a stable level. For the second question on class suspensions for kindergartens, for the concerned school, Gia Lam 幼稚園, we have advised the classes with suspected transmission to suspend classes, a total of 4 classes requiring class suspension due to suspected in transmission within the classes. But however, for the other classes within this the kindergarten, there is no evidence or no signs of transmission, and also there were only sporadic cases, so there is no need to suspend other classes. But however, we have advised the schools to enhance the infection control and also disinfection of the premises, so that to prevent further disease transmission. For the last question on RAT, we encourage people, if they have symptoms, they must do testing, and also for persons who will attend who will have mask off activities with other people, or especially with people at high risk, they are also encouraged to do RAT in order to detect to diagnose themselves if they were infected.
Dr. Lee?
For the question on hospital authority, maybe Dr. Lee can supplement.
Okay, hospital authority work closely with the government to state our best preparations for the coming potential wave and any upsurge of the attendance. And our preparation will be in terms of three perspectives, in terms of the hospital level, the community treatment facility level, and also the outpatient level. So for the hospital, we aim the opening of the more than 10,000 bed as mentioned in the fifth wave. And actually, we try to mobilize some bed at a real time zero, and also at sometimes when there is more patients coming. And actually, the bed mobilization plan is reassure. And also for the community treatment facility, we have a roster so that we can have a plan, can open up the Asia World Expo community treatment center within 72 hours, and also we can increase the ward capacity of the Hong Kong ICC in 24 to 48 hours. And also we have 7 designated clinics been operating at the moment, so we encourage Hong Kong people. So if they get confirmed, please report, and also please seek help from hospital, or maybe if the mild situations, please go to the designated clinic, because a earlier intake of the oral antiviral drug for suitable patients can decrease the mortality and also the complications.
下一題，前面呢位男士。
Ming Pao, first of all, HA mentioned when the facilities are activated, what are the details? Which clusters can deploy resources? Do you have sufficient manpower? You mentioned different facilities that could be activated. Could you clarify what can be activated at what time? And HA mentioned that they have an emergency coordination center. Is it in operation now, or when will it operate? Just now, CHP said that you want to prevent people from engaging in high-risk activities, but we see that different residential care homes have outbreak. So in the last 7 days, how many RCH had cases? How many cases were involved? And in the fifth wave, a lot of RCH said that when cases appeared, there wasn't sufficient support. They felt helpless. So they asked for more intergovernmental support, and they want CHP to provide more guidelines. And are there any improvements or update for RCH? And lastly, you said that the Homantin construction site, how long will operations be suspended? Our roster is based on past experience. The doctors, nurses, or support staff are deployed from the 7 clusters. We will arrange staff to help out the community facilities or quarantine facilities. I mentioned, for example, AWE or North Langtao Hospital, Hong Kong ICC. The 2 of them are based on our past experience, and we feel that in the first 48, 72 hours, that is the most critical phase, and we want to activate them during that period. You mentioned the emergency coordination center. We have this backup plan. We'll have to keep an eye on the pandemic, and when necessary, the HA Central Command Committee will decide whether to activate the coordination center. Regarding RCH, we focus our efforts in high-risk groups, including RCH, schools. Recently, we have seen more cases from residential care homes. That's within expectation. So when community infection goes up, people working in RCH, they are a part of the community. They have increased risk of infection. Most importantly, to prevent cases from spreading in RCH. And in the last 7 days, we recorded 11 RCH, including 7 old age homes and 4 disability homes. So there weren't large outbreaks. Only 2 disability centers had large outbreaks. There were 5 and 14 cases respectively. The rest, we had staff being infected. So that's within expectation. We will see more of these cases.
翻即係
So we'd all like to remind staff of residential care homes as well as residents to get tested via RAT every day so as to identify cases as soon as possible and to implement disease prevention. For example, infected patients can be sent to a holding center for the elderly or to isolation facilities as quickly as possible, and for other affected residents to be sent to quarantine. As for schools, again, it is important. We have identified minor outbreaks for the moment and not major outbreaks. We advise teachers and students to get tested every day by RAT so as to minimize transmission within the campuses. The measure has been effective. For example, in the past 2 weeks, there is an obvious surge in the number of cases with upper respiratory tract infection. So for students who keep their mask on, there is still a risk of this virus spreading. And if we're talking about COVID, then it is likely that transmission can take place as well. So these measures are necessary to minimize transmission in schools. For these measures, as the 5th wave stabilizes, the Labor and Welfare Bureau, Social Welfare Department, etc., have liaised with homes to enhance the facilities. For example, we have set up a platform so that residential care homes can report to us their daily RAT results of their staff and residents. If necessary, we'll follow up on the positive cases. And recently, the Social Welfare Department has upgraded the platform, and we're still using this platform for homes to report the positive cases to us so that we can immediately follow up on them. The Permanent Secretary for Labor and Welfare also chairs a cross-department meeting, interdepartmental meeting to discuss how better support can be provided to residential care homes by these departments in light of the possible upsurge. And I believe announcements will be made soon. As for this construction site in Ho Man Tin, earlier, we identified 4 cases belonging to the same team, but there are different teams, and different teams of workers may use the different containers. They may not work in the same location, and we have again identified new cases. And previously, for the 4 new cases identified, we have already advised all workers to get tested. And as a result, we have identified 3 more cases. A compulsory testing notice will be issued today to ensure that everyone working at that construction site will undergo a PCR test. The construction site will be suspended for the time being, pending PCR results of the workers, and will also conduct a site visit to see if any improvement is needed, and works can resume when we find the situation safe again. Last question. I'm from Cable. My question is this. About the 20 cases in the cluster of the anti-terrorism unit of the police, why hasn't it been announced? Is it because this cluster bears a low risk? Do these officers conduct patrols outside as well? If so, which districts have they visited? About Rack City and Shuffle, You mentioned that after genome sequencing, these cases have found to carry the same subvariant. Well, are there further transmissions for these bar clusters? Has the transmission link been curbed? Can you say that for clusters in bars, we have come to the end? As for the cluster within the police, we are following up on these cases, and having received reports, we checked, for example, how many cases are involved, and we also take follow-up measures in relation to the workplace. For example, we demand thorough cleansing and disinfection of the workplaces. We conduct contact tracing, and we also conduct epidemiological investigation. As we understand, this is an internal department or unit, and the colleagues involved have no contact with the public, and the workplace is also an area close to the public. And we have conducted investigation in relation to this outbreak at the workplace. And for the time being, we are liaising with the police closely. And we'll also closely monitor the situation should the new cases arise. According to gene sequencing analysis, there may be links between different bar clusters. And previously, we noticed that for, say, some cases, they might visit different pubs each night, or they may visit different pubs different weekends. So perhaps one case got infected, sparking one cluster, and then the case visited another pub, causing another outbreak. As a result, the transmission chains just continued. And once identified, we do ask everybody who have visited the premises to get tested so that we can find out about the silent cases and cut transmission links. For Rec City and FLM, we have not identified new cases. We believe them to be the end of the cluster outbreak. And so far, there haven't been other bars having major outbreaks. And we'll continue to check the Leave Home Safe apps data, and we'll continue to conduct contact tracing to see if there is any epidemiological link or other major outbreaks in bars. The speaker's not coming through. When you talk about workplace, where exactly is it? Is it because they had a meal gathering? Is that the cause of infection? That's the end of the press briefing. Not 5 workplaces, just 1. So what kind of internal unit or department is it?